I know there's going to be a lot of women out there who's going to have plastic surgery. I say, all right, whatever floats your boat, fine. But do we really need to spell it out to our 4-year-olds? Are they really ready for that conversation? I don't think so. But that's the goal of a new kids book. It's called My Beautiful Mommy. It's basically a picture book that lets kids know why mommy got a nose job and a tummy tuck. Well, we went at it. Here's the author of that book, plastic surgeon Dr. Michael Salzhauer. I want to say I get where you're coming from, and I applaud you for trying. I'm sure that I'm not there, and moms have to explain somehow. But I think you went wrong with the message here. I think too much of the book, and we'll get into some of that, is image is more important than inner beauty. Do you really want a 4-year-old coming out of this questioning their appearance?
Well, Mike, if you read the book, what you notice is the page that you took out of context there, the one that is so controversial.
You know where I'm going.
Where the mom says, my nose is not just going to be different, it's going to look prettier. The preceding page, they're driving home from the doctor's office, the mom says that she's going to look different after surgery. Now, to a 6- or 7-year-old child, a different nose could be a witch's nose, a pig's nose, and that's what you see in the thought bubble above the girl as mom's telling her their nose is going to look different. So to counter that, the mom then says, no, not like a pig, not like a witch, it's going to look prettier. And that is why mom's having the surgery, because she's having the surgery because she wants her nose to be prettier. This book is not making a value judgment. The mom has made a value judgment. She's made the decision to go ahead with the surgery. And she's got, a young child at home. She's going to come home with black eyes, a cast on her nose.
No, I get that.
Bandages.
Right.
And in my experience, in my practice, and I have an 8-and-a-half-year-old daughter at home and a 5 and a 3 and a 2-year-old. So I have 4 children. So
let's stop it right there.
I get the message,
I want to go back to that last picture and I hear you. But there's just some just seeing mom with a witch's nose and a pig's nose. If you're reading this book, does that mean that if my nose isn't perfect, that it's equivalent to a pig's nose or a witch's nose? Those are the issues I have.
That's not the message that you get from that. When you read the book through, again, this book is written from the eyes of a child,
right,
to try to explain to the child what they're going to experience in the next 2 weeks. When a mom has plastic surgery, a mom is the pillar of the house. Everything revolves around her. When she is out of commission for 2 weeks, okay, the kids are going to notice.
Right.
If she doesn't pick them up from school, they're going to notice.
I get that. You got to explain something here. I want to go to that one other picture, and it shows mom when she's explaining the tummy tuck.
Sure.
There's a picture of mom, and she looks like an ogre, like she just got out from under the bridge. I mean, again, that's like the image thing. Our kids fight it enough. Then there's the shot right there. Since when does mom look like that? Because she has some loose stomach skin. I don't get it. She looks like an ogre.
No. Mom has made the decision to have plastic surgery, okay? This is not a general children's book. This is not like Goodnight Moon. You're not going to read this to your kids before they go to sleep. This is designed for specific patients, moms actually, that have made the decision to have plastic surgery. It's going to turn their household upside down for 2 or 3 weeks. Their kids are going to notice. In my practice, when patients, and increasingly so, they bring their kids to the post-op visits and the pre-op visits, and the kids get scared. They think mommy's dying. What's going on? And a lot of parents don't tell them, and this book explains it to them.
Doctor, again, I appreciate that you're trying to explain. I just think a revision, clear up the message. Maybe we'll talk again.